Hello folks, my name is Dr. Dhaliwal. I'm the director at South Etobicoke Animal Hospital in Toronto, Fletcher's Creek Animal Hospital in Brampton, Countryside Veterinary Mobile Services that covers almost all of Ontario. Today we're going to talk about our wonderful partner, companion, Noah. Noah was presented being blocked. It's a cat, 15-year-old cat, and had trouble peeing. This typically happens in cats that are neutered at an early age and they're on a diet that has a lot of phosphorus in it. So chemical reactions take place in the urinary bladder in the presence of urine and other chemicals and other ingredients in the diet that precipitates them into triple phosphate crystals. These crystals are pretty sharp and first tend to cause bruising in the bladder, then causes difficulty in urinating. The cat penis is very tiny, and a little bit of bruising will cause obstruction to flow of urine. And if that happens, the cats tend to lick their back end quite a bit and cause further bruising. The term we use for these cats is FUS, feline urologic syndrome, or FLUTD, which is feline lower urinary tract disease. But in reality, it's a very serious problem because when the bladder is unable to evacuate the urine, there's a backflow pressure on the kidneys, and some of the protein byproducts like urea and creatinine, they keep adding up in the system, leading to first there's pain for the bladder being distended for so long. Second, the kidneys are overloaded with a lot of protein byproducts that makes the brain go crazy, and they want to get that product or byproduct out a different way, and cats start to vomit. And that's a medical emergency. There are 2 or 3 types of different crystals that form in a cat. One is the triple phosphate crystals, 2 are the oxalate stones, and number 3 are amorphous, a mixture of both, because clients are feeding good diet and bad diet at the same time, means healthy food and treats. Cats don't need treats. So we're looking at now a condition where a cat is blocked, means it cannot pass the urine. Cat is crying, meowing in pain, and that's typically a bladder that is blocked and the cat is now in immense pain. That is an emergency. Rush to your vet. They'll probably do some blood work, get some sedation done, pass a urinary catheter into the bladder and try to unblock or allow the urine to pass from the bladder outside. That actually eases off a lot of tension. And we have Noah. Noah's a 15-year-old cat that we mentioned initially, and it was a tough surgery because multiple catheterizations had been done at different places, and there was severe trauma to the outflow tract of the urethra. We proposed to the owner that we may try to go in, and if we do find it not being that normal or not a good candidate for surgery, then we might have to take the final decision. But the owner was really interested in seeing if there is a chance. So based on her recommendations and her strong willpower, we went in. We found out that actually it wasn't difficult to catheterize Noah, and that catheter acted as a guide for us to do our reconstructive surgery on the urethra of Noah. And we were able to do a successful perineal urethrostomy. Within 2 to 3 hours after surgery, Noah was up and about and actually urinating on his own. Sometimes a problem occurs when the bladder is distended or full for too long. The bladder loses its control over contracting to squeeze itself to get the urine out. And we may have to put cats on different medications to help that. But in Noah's case, it was the other way around. This cat has full willpower, wants to go on, even at the age of 15, very strong personality. So after about 6 hours of surgery, Noah was up and about, not in any pain at all, and drinking water and urinating well. And today Noah is in for a second day of monitoring. There's no bleeding at the back end, and we put him on IV fluids just to flush out all the protein byproducts through the urine, and seems to be working well. He's been urinating a big stream, and he seems to be a very happy cat now. So good luck to Noah for his recovery, and kudos for the willpower for cats to survive.